Hi, this is Vikash, and today we are going to discuss about a pre-transplant candidate. And if you haven't seen my first video, in first video we have talked about a well-compensated liver cirrhosis candidate, and today it's a pre-transplant candidate. So, telling you the clinical story of this fellow. Let me show you reports page. And so this is profile an obese guy, and at the end of January, this guy became confused at work and couldn't even remember a client name. Started slurring his words. His colleagues were alarmed, and his wife taken him to hospital. He arrived jaundiced, confused, with a massively distant abdomen and legs swollen up to his knees. He was diagnosed with NASH-related decompensated cirrhosis with HE, tense ascites, and acute kidney injury. His MELD on arrival was approximately like 28, and over the next week he is stabilized. A small liver cancer is found and confirmed also, and he is fast tracked for transplant. So this is his profile, and these are his reports. A couple of reports I'll take you. So this is one report. This is a CT scan report, and you can see that all the findings that's been fetched by our AI engineer. Similarly, other reports are also here that we can go through one by one. But but in last video I have demonstrated you people that how you can upload report, and our AI engine will extract content from those reports. So if you missed, let me tell you again that so far our platform is ready for all the NASH related liver diseases, right from fatty liver and FLD to fibrosis, cirrhosis, compensated, decompensated, and pre-transplant candidate, all related to NASH. And the reports that we are supporting till now is blood work, endoscopy, CT scan, fibroscan, ultrasound, and paracentesis. So almost everything we are covering here, and the purpose of sharing this video is to get some feedback from you doctors. So these are some reports, and let's go to the dashboard first and try to understand what are the findings. So you can see the MELD score is 30 and Child-Pugh score is 13. So you can understand it's a well decompensated case where patient is listed for transplant. There is 6 exceptional points, and our system is designed such a way that it will adapt for different cases. For fatty liver disease, it will have different element. For pre-transplant, it will have all the different cards and elements that will enable our patients to put the information and get all the information. So for example, here we have fibrosis assessment, and then ascites monitoring. In normal cases, in non-cirrhotic cases, we don't have ascites monitoring. Similarly, for HE status also, we have a special card here, and I'll show you people how we can put these datas. Okay. Then again, we have AI summary where it's mentioned that your liver health require immediate medical attention, your liver enzyme are currently elevated, and all these things are there. And then we have trending data. So you can see we have 4 blood work, and it is the bilirubin trend is something like it has started with 9.80, and right now it's 7.00. So similarly, you can see all the trending data here. And now I'll take you to the analysis part where we have AI intelligence, and in AI intelligence you can see that right after admitting to the hospital, when we have couple of drainage and all, the patient has started to get a bit of relief, and his condition is improving, but although he required transplant immediately, but the condition has been improving. Liver function score is still very bad. Same goes with the kidney function. Coagulation is still very bad, and we can understand that nutrition is also not that good. Let me take to the medical scoring page quite quickly. So here is the medical scoring page, and MELD score is 30. If you remember, 6 additional point was allocated for the candidate since he is a transplant candidate, and everything autophaged using the blood work and all the reports that we have uploaded. Similarly, we have childbirth score of this candidate, we have fibrosis assessment and ascites assessment also. So I get everything. If I take to the patient profile page, if you go to the patient profile page, you can see that is transplant candidate and ascites is moderate. He also has HE and grade 1 to 2. Then we have transplant readiness status. Blood group is this, listing status is under evolution, and exceptional point is 6. Then we have ascites management, and what are the medicines that doctor has been prescribed is mentioned here, and what is the diuretic response. Similarly, for HE management, the medicines that you have are mentioned here. So this is very brief about this account, and if you use mobile phone and our app, you will see something similar there also. Let me take you to the imaging analysis, and in imaging analysis we have some more information. For example, the ascites is moderate, portal hypertension has been quite visible, it's a large spleen detected, and there was one lesion also, and the size of that lesion is 2.4 and which require immediate attention. Similarly, the other organs, the organ related to disease, liver, spleen and ascites, these things we are monitoring. We are also monitoring the candidate EVL treatment. So you can see the EVL is been, after banding, it's getting better and better. And then spleen comparison is here. In his first report, the spleen size was 19.2 centimeter. Right now it's 19 centimeter. So we can say it's stable, and a few of the suggestions from our AI engine. Okay, and all the reports are here listed here. You can see it started with the CT scan, endoscopy, MRI, endoscopy, fibroscan, and everything. And in all the reports we have filed, you have found complications. Now, for these candidates who have episode of HE and who have ascites problem, we have daily logs where candidates can manage their daily weight and their girth, so that they can find out whether they need any kind of drainage or not. Let me show you what are the fields we have. We have weight. Right now it's in kg. We will definitely provide a unit based on your preferences, and symptoms are here: leg swelling, none, mild and moderate, and then the medication, patient can also monitor that. So everything is here. You can see that at the very first entry the weight was 104 after the drainage. So it's mentioned here that 8 liter drained yesterday, but belly feeling again, head is clear, know where I am now. So these things are there. So for these candidates who have this ascites problem, we need daily monitoring, and for that we have the daily log. We want feedback from you doctors so that we can make it even better based on your particular feedback. We can customize this application as per your requirement. The small brief is here, and then similarly we have HE card here. You can see the ammonia level is 45, and it was last checked 28 days back, and this is the medicine that's going on. We also have chat that will work as per the liver condition of this candidate. So for example, if I'll ask that check my ammonia level, and suggest if I should see doctor. So it will face the latest information from your reports and your profile, and then it will suggest as per the guideline that we have to follow for AI implementation, and especially in this AI chat. Similarly, if I'll ask anything related to, for example, if I'll ask, can I have fish Then it will again see your report, your present condition, and it will suggest whether you can have fish or not. If you use our mobile app, in mobile app we have an option to scan the product, their barcode, their ingredient list, and based on your present disease status, our AI engine will suggest whether you should consume that particular product or not. Our mobile app has a lot of other features. I'll try to make a new video for same candidate using mobile app, so you can see what are the feature and services that we are providing in mobile app at present. And we definitely require useful feedback, so we can customize things best for our patients who need these application. And I hope to get feedback from you people. Thank you very much.